All right. So, Claire, can you explain what PCOS and endometriosis are in simple terms, and what are the common symptoms as well?
So, with polycystic ovarian syndrome or PCOS, we often see it present in a couple of different ways. The two most common ways that I would see it in clinic is the insulin resistant form of polycystic ovaries, where there is a dysregulation of the body's ability to use glucose for energy, and that in turn can affect our hormones. And then the other side is the androgen dominant PCOS, where our body isn't processing and eliminating hormones as effectively as it could be, and there can be a buildup of hormones like um, testosterone or our sex hormone binding globulin. So they're the two ways that PCOS would present, and endometriosis is commonly known as an inflammatory condition. There is research into it possibly being an autoimmune type condition. So, naturopathically, we look at how we can manage the inflammation and support women, because the symptoms predominantly with endo would be quite severe and debilitating period pain that doesn't always occur just around a woman's period. It could happen during the ovulatory window, um, as well as other points in the cycle. And that endometriosis is effectively um, small growths of tissue that can adhere to the lining of the uterus or around the ovary or even near the bladder or the bowel. So women can also experience pain during urinating, pain during passing a bowel movement, pain during sex as well. So there are some of the most characteristic symptoms of endo would be pain and discomfort,
Mhm.
whereas with polycystic ovaries, we don't often see period pain as a symptom of that condition. The symptoms with the PCOS are more likely to be as a result of the insulin resistance, so difficulty to lose weight, um, increased appetite, perhaps mid abdominal fat, not being able to shift fat tissue around the waistline, carbohydrate cravings,
Mhm.
whereas the androgen dominant polycystic ovaries, we could see symptoms like excess hair growth. We can have irregular menstrual cycles where the menstrual cycle doesn't happen every sort of 28 to 30 days. It might happen every sort of 35 to 40 days or even longer between periods.
Mhm.
Um, that they're the most common characteristic symptoms I would see.
All right. And do you know if there's any contributing factors to PCOS or endo as well?
It's a good question. I feel like as research has developed, we've got more information around what drives these kinds of conditions. I guess when we're looking at things that drive polycystic ovaries, we can look at lifestyle factors as potentially driving that. So, a diet high in refined carbohydrates and industrialized vegetable oils like canola oil, vegetable oil, palm oil, um, like a
Mhm.
diet that contains a lot of takeaway food or processed food can certainly predispose someone to PCOS, because they can be big drivers towards that insulin resistant
Mhm.
type polycystic ovaries. Also, a diet that's lacking in a variety of polyphenol rich foods, which we get from fresh fruits and vegetables and legumes and nuts and pulses, can lead towards the insulin dependent and the androgen dominant PCOS. So
Mhm.
I think lifestyle can affect PCOS from that perspective. Endo is quite different. There are certainly more information about environmental factors that could be contributing to endo. So, looking at exposure to plastics and fragrances and environmental toxins that be mimicking estrogen compounds could certainly be contributing to the increased incidence of endo, um, as well as, yeah, I guess endocrine disrupting chemicals that we consume in our water and that we're exposed to in pollution. So it's not a definitive cause, but it is likely to be a contributing factor to the
Mhm.
increased number of of that. Because effectively with endo, it's the body not producing, adequate amounts of certain hormones and not eliminating or breaking down another amount of um, yeah, other hormones. So yeah, I feel like they're kind of the big drivers that would be contributing to the conditions.
Okay. And I know, a lot of the symptoms that you've described can happen for different reasons. So how do you typically help diagnose PCOS or endo? I know it can be a little bit tricky sometimes as well.
Yeah, it can be tricky. First of all, as naturopathic practitioners, we can't diagnose any medical conditions, but we are trained to really look at a classification of symptoms and see
Mhm.
how they might be yeah, medically diagnosed and what we can do naturopathically to look at that. So, if I had a patient come to me that was presenting with irregular periods, difficulty to lose weight, acne as a symptom that I forgot to mention earlier, then perhaps we would question
Mhm.
whether or not PCOS was an underlying cause of those symptoms. And
Mhm.
I would refer the patient to their GP or gynecologist to get a full blood count done that looks at their insulin, their glucose, their androgen hormones, as well as an internal vaginal ultrasound that can actually get a physical look at the ovaries to see the number and size of follicles that might be on the ovaries. Um, and then for endo, it's a lot trickier to diagnose endometriosis because at the moment, the most current way to diagnose is through a more invasive laparoscopic procedure where tissue needs to be identified internally. However, research has developed, and there are now these deep infiltrative ultrasounds that can get a much better look without actually removing the tissue from the reproductive tract. So, there and potentially blood tests are emerging that are looking at markers that are common within patients of that have got endometriosis. So there is something, yeah, something to look forward to there with the science levels changing.
That's great. Yeah, great to hear because I think it's for a lot of women it's been hard to understand what's happening to them as well when it comes to that. So now looking at, if you know that you're, suffering with either PCOS or endometriosis, what are some of the, strategies that you might be using to help managing the symptoms first?
So with PCOS, it would be again breaking it down to look at whether it's the estrogen, the insulin resistant picture or the androgen dominant picture. There are other situations that arise with PCOS that we want to address, but they're kind of the two big areas that we would be looking at putting a
Mhm.
treatment plan together around. And sometimes it's a combination of both of those things. So, if insulin dysregulation is happening, then we put together a dietary plan that is really rich in varied types of protein, complex carbohydrates, lots of unprocessed fruits and vegetables that can help the bowel really eliminate waste effectively and process excess hormones that need to be eliminated. Um, and with endometriosis, it is often similar approach to that insulin dependent, insulin um, dysregulation type picture. We want to make sure that there's stable amounts of protein throughout the day so that there aren't big spikes where people are craving high refined carbohydrate, fatty foods that might have those oils and those sugars
Mhm.
that can drive inflammation. So overarching, we're looking at like an anti-inflammatory style diet that's similar to the Mediterranean style diet, that is just low in processed foods,
Mhm.
as well as specific nutrient groups that can adhere to, improving symptoms that these women might be experiencing, as well as herbal medicines that we can use to help support as well.
Right. And what you've just described now, is it also addressing the root causes of those two issues as well?
Certainly with PCOS, it
Mhm.
is. If we can regulate someone's insulin picture or get them metabolizing their androgen hormones more effectively, then it's definitely getting to the root cause. With endometriosis, it's very tricky because if there are these ongoing environmental elements to the condition or underlying autoimmune factors that we haven't yet
Yeah.
uncovered, it's not so much of a remedy to fixing the condition, but managing the symptoms so that women can have less painful periods, more enjoyable sexual experience, less discomfort in their day to day lives with bowel movements and urinating.
Mhm.
So, yeah, it is, peeling back the layers to support women with how they experience their endo symptoms.
Okay. And how do naturopathic treatments differ from more conventional, medical approaches when it comes to managing those symptoms as well?
In my experience, patients that I have seen that have been diagnosed with these conditions and have already been um, treated, for lack of a better word, by their doctors or their specialists, they
Mhm.
have all been put onto the oral contraceptive pill,
Mhm.
which, as we know as naturopathic practitioners, is not a remedy for these conditions. It might halt some of the symptoms,
Mhm.
provide some short-term symptomatic relief, but it won't change why the condition is there.
Mhm.
So it's quite different. We certainly are looking at how we can manage the hormone synthesis, production, regulate how it is being produced, and minimize the things that might be contributing to causing the issue
Mhm.
from being worse. Yeah.
Yeah. And we know as well, like many women that are struggling with PCOS or endometriosis as well, have also fertility issues. Could you perhaps tell us a bit more about the naturopathic, remedies or strategy that you use to help support these women with their fertility or, reproductive health as well?
Sure. I feel like it's often one of the things that we uncover when we're working with fertility patients is that they didn't know that they did have endometriosis, or they didn't know that they did have polycystic ovaries to begin with. So it can put a little bit of a roadblock in their fertility journey, but
Mhm.
for their long-term health and well-being, it can be a remarkable discovery because it means that they can, in some cases, fall pregnant, have a healthy pregnancy, have a healthy child, and then go back to a healthy reproductive system.
Mhm.
Um, so the strategies that we would be putting in place for women for fertility purposes are quite similar to those when we're treating, um, you know, the PCOS or their endometriosis, in that we're trying to reduce the inflammation and regulate that glucose and insulin response so that they can produce enough progesterone to conceive and stay pregnant, because that's one of the things that will often happen with both of these conditions, is that the body sometimes does suppress the amount of progesterone that can be produced, which is one of the hormones that we need for pregnancy to take place. So um, Yeah, so it's a lot around looking at herbal medicine that we can use to help support the body's progesterone production, as well as lifestyle factors by reducing stress. That's a big one, where we can invite other modalities in as well to help support the body's stress response. We talk a lot about cortisol regulation and reducing cortisol and how can we reduce stress hormones, and it is a huge factor that needs to be addressed with lifestyle, as well as some really nice nutritional supports like good quality high dose magnesium, um, using herbs like passion flower and withania, always, of course, tailored to the individual, but um, addressing the stress response is a really important part of managing these women's um, conditions.
And I know you've mentioned, working with GPs or other modalities. So how do you, in general, collaborate with other healthcare providers or practitioners to help your client manage their cases as well?
I personally am really guided by the patient or the client and what level of engagement they would like me to have with their other practitioners. Um, if I'm working with a patient who is under the care of a gynecologist or an obstetrician and would like communication between us, then I would put together a letter of correspondence that outlines all of the natural approaches that we're taking to support them. Um, and similarly, if I'm working with an acupuncturist or an osteopath or a pelvic care physiotherapist, or a kinesiologist, we can communicate just via email, updating one another with what's happening during that patient's treatment protocol, or there can be letters put forward so that it's documented in the patient's file as well.
Wonderful. Thank you. Could you perhaps share some, success stories of patients that you've worked with in the past?
Sure, I have had, I don't know whether it's luckily, but it's been really nice to be able to support a number of women with their PCOS, particularly couples that have been trying to conceive for some time. And I had, one of the couples that comes to mind. I was working with them 3 or 4 years ago, and they had been going through IVF, and the woman did have undiagnosed PCOS. I don't quite know how she got so far into her treatment journey without having that identified, but she did have really high levels of androgens. So we used a lot of dietary techniques to help, get her body eliminating and reducing the amount of testosterone and something called sex hormone binding globulin that was in really high levels that we detected through blood tests, and using herbal medicines to support her body's nervous system and adrenal glands, as well as just using nutritional medicine like zinc, magnesium, essential fatty acids, methylated B vitamins to help improve her overall fertility status. Um, she went on to fall pregnant, and I'm now working with her for her second pregnancy, which is just delightful. And yeah, I mean, I feel like, every week I get the opportunity to, you know, um, celebrate the small wins, whether it's something like helping a woman regulate her menstrual cycle to become, back to a monthly routine to help support her overall health, or for women with endometriosis to be able to bring their, excruciating period pain down from like a 10 out of 10 to a 2 out of 10. Like I've had a number of women who, yeah, have been, they can't go to work. They're in the fetal position, debilitated with hot water bottles and high amounts of painkillers every single month just to be able to cope with their endo pain and to be able to get them functioning to a point where they can still go to work. They still do experience pain, but they don't need the high level of pain relief that they once did because their bowels are working really well, their bladder is working really well, they're eating a really balanced nutritional um, variety of foods every day, and their mood is improved as a
Mm.
as a result of making all of these wonderful changes. So, yeah, there's a number of people that I feel really lucky to have been able to help, but it's never a quick fix. It
Yeah.
takes time for these changes to take place. Yeah.
No, but it's great to know that there are alternatives to, as you said, just taking painkillers and just waiting for the pain to go away. There are things that can be done, as you said, not a quick fix, but if you get the right level of support and advice, there is hope. And I think that for a lot of women that are struggling with those type of issues, sometimes it can feel they can feel a little bit helpless. So I think
Mm,
that's nice to know.
yeah.
I know you've mentioned, a lot of different things around, lifestyle changes to nutrition to herbs, but if you were to, I guess, maybe summarize, if you can, or maybe give us your, top 2 to 3, general tips or advice to, anyone that is struggling with either, yeah, PCOS or endo, what would they be?
I think some of the most common things I would see between the two conditions that I recommend frequently would be to be having high levels of cruciferous vegetables in the diet. So things like broccoli, cauliflower, Brussels sprouts, cooked kale. Um, these beautiful vegetables are really high in a compound called sulforaphane, which helps a lot with estrogen metabolism. So it makes a big difference for both of these conditions. So I would almost always recommend that women are including these foods in their diet weekly in good amounts. I would always be recommending keeping alcohol intake low, so under sort of 5 drinks per week is my general guideline because it will contribute to a lot of gut and liver inflammation if there's more than that each week being consumed. Particularly for the endo patients, it can make a really big impact on, yeah, on their symptoms. The polyphenol-rich foods, which I mentioned before, so really colorful foods like purple cabbage, black currants, blueberries, um, all of your legumes and pulses like chickpeas and black beans and kidney beans. These foods are a really great way to boost the body's antioxidant status, and again, that helps with how we experience inflammation in our bodies. So, consuming these foods in abundance every day is really helpful. And then the other one is looking at getting adequate protein at least 3 times a day. It doesn't need to be animal-based protein, but getting about 25 grams on average per meal for breakfast, lunch, and dinner is a key component for women's hormone health, you know, whether they have PCOS or endometriosis or trying to conceive or going through perimenopause. Yeah, that's an essential one as well.
Thank you so much. And if someone was coming to see you for a one-on-one consultation, how would you tailor your advice to the specific case of your patient?
Well, I guess it would start by getting a really comprehensive case history. So, learning about their health at different stages in their lifetime. When we're working with women, we want to know, what age did they get their period? What was their period like when they first started? Have they ever been on any hormonal contraceptive? What was it like once they were on the contraceptive? Trying to establish what their diet might look like and then putting together a plan of introducing these other suggestions that I mentioned before into their day-to-day routine. And then there would be some supplement and herbal medicine advice as well. So at the end of an appointment, there would be a little treatment plan protocol put together for them that has their personal dietary recommendations, any pathology or medical interventions that might need to be done. So if I feel like a person needs to have blood tests done, I might put down that recommendation for them to do that with their doctor, or I can also put a pathology request through for them as well. Um, and yeah, they would have tailored advice around what dose, what form, which brand of nutrient is most effective for them. There's a big difference between a lot of the stuff that we can recommend as opposed to what you can get from the supermarket or, in some cases, the pharmacy. So, giving that specific advice can be really helpful for a patient as well.
Perfect. Yeah, I guess everybody's different, and so we can't really have a one-fits-all treatment for everyone.
That's right.
Perfect. Well, thank you so much, Claire, for all of your, advice and for sharing your wisdom on those Endo and PCOS as well with us today.
My
And for
pleasure.
anyone, who is interested in exploring that a bit further, and as you've mentioned, having a more personalized approach, we'll share more details as well about you.
You.